A record number of parents are choosing not to vaccinate their children, according to the latest government figures. More people than ever are registering as conscientious objectors in order to sidestep rules that block welfare payments if the child is not immunised. Here's Dr. John Cunningham, who's an epidemiologist practising both at the Royal Melbourne Hospital and at Melbourne's Epworth Private Hospital. So, John Cunningham, firstly explain how parents are able to opt out of vaccination.
These parents are exploiting a loophole which allows them to not vaccinate their children but still obtain the family benefit money for vaccinated children. So they're losing about $2,000, which they gain by getting this form signed. The form has to be co-signed by a general practitioner, so it's not an argument that they don't have access to vaccination. They are doing it intentionally. Unfortunately, most of them have been confused or waylaid or misled by the leaders of the anti-vaccination lobby who spread their fear and hysteria. People such as Sherry Tenpenny, who was from the United States, who was recently in the news as well.
So you say that parents, though, have to get this signed off by a GP or another medical practitioner. So they get the information, so surely it's up to them to decide.
Well, unfortunately, they're also getting information from less reputable sources, and they're the people that are spreading the lies, the dangers of vaccination, which of course are simply lies. Vaccination is a key aspect to the health of society, and the argument is that if people don't want to contribute to their health of society, well then why should society contribute to them in a monetary term? We don't recognise conscientious objection for things like having a driver's licence or voting, so why should we recognise it for vaccination?
But only about 2 to 3% of children aren't getting vaccinated, according to some reports. That number is pretty static. Still leaving then 97 to 98% of kids who are getting the shots that they should be getting.
The percentage of vaccination varies greatly across Australia, and there are pockets, especially in the eastern suburbs of Sydney and the northern parts of New South Wales, where the vaccination rate is incredibly low. And we know from research that those areas where there's a low vaccination rate are very prone to a disease outbreak should it occur again in Australia.
And there is a strong argument that the increase in the number of people who are against vaccinating has just come about because now they have to register in order to collect welfare payments. The numbers haven't changed, they're simply more visible.
Well, we certainly are getting a better handle on the rates, but from other studies that have been done in Australia across the years, we do know the rates from, say, telephone interviews and also reviews of when outbreaks occur. We can quite quickly gather the data that talks about the number of people who are vaccinated and not vaccinated, and inevitably the people who are unvaccinated are always overrepresented with their sick children.
Some parents, though, of course, do have strong religious objections to vaccinations. Jehovah's Witnesses, for example, are against any outside medical intervention.
I don't believe Jehovah's Witnesses do. I think Christian Scientists are the only ones that, as a religion, object to vaccination, and they're already mentioned in legislation. Certainly, religious objection is a different kettle of fish altogether to the overwhelming majority of these objectioners who are basing their decisions on bad information.
So what's happening to childhood disease numbers, John?
Well, fortunately for things like meningococcal, they're plummeting because the vaccination has been so effective and so well rolled out. Unfortunately, whooping cough makes a comeback every now and then. And even a few years ago, I mean, people are still dying of pertussis. It's just awful.
Dr. John Cunningham, thank you.
Thank you.